100 years ago, goiters were a prevalent issue in the U.S. and Switzerland due to iodine deficiency. To address this issue, they began iodizing their table salt, something most of us take for granted today. Within a generation, the goiters all but disappeared. This is an example of a micronutrient deficiency and an effective intervention.
It's an easy shorthand term to apply rather than having to say vitamins and minerals, but maybe we should change the term from micronutrients to mighty nutrients to stress their importance.
Today, 1 in 2 children and 2 in 3 women globally are affected by at least one micronutrient deficiency. In most developed countries, large-scale food fortification policies are in place to prevent micronutrient deficiency, which is good because these deficiencies can have devastating long-term effects on children and pregnant mothers and cause birth defects.
In some cases, for example, with vitamin A deficiency, can lead to childhood blindness. And in the worst cases, certain vitamins and minerals that affect the function of the immune system can place individuals at greater risk of infectious diseases and ultimately mortality from those diseases.
Vitamin A, zinc, iodine, iron, and folate are 5 of the most common mighty nutrients missing from diets around the world. Interventions such as multi-micronutrient supplements for pregnant women and large-scale food fortification have been evaluated by leading global economists.
These are some of the most cost-effective interventions in all of development, not just in all of public health. For example, ensuring that moms have prenatal vitamins has a return on investment. $1 investment leads to $37 in return.
So why don't they act? In many cases, decision makers aren't aware of the problem, and we lack the data to drive the necessary policies.
It's important to have the data to convince the policymaker, but best yet, if you have the policymaker or the decision person with you to witness the problem and tell them what's going on.
This is how data drives the fight against hidden hunger.
Every time I hear the hidden hunger, I say we have to bring it out into the light. What we need to look at is how we can make them visible.
Unfortunately, there's every reason to suspect it could get worse without action because we're facing a global food price crisis, and that means that families are increasingly unable to afford a nutritious diet, and those negative impacts accrue more and more to the poorest families.
Relatively little data has been collected on micronutrient deficiencies over the past 20 years, particularly in low and middle income countries.
We really need to have a revolution in our ability to generate up-to-date data on deficiencies so that decision makers can plan programs, follow programs, and make sure that the people who need these solutions are getting them and that they're effective.
Identifying the biomarkers of micronutrient deficiency in a population is costly. First, a representative sample of individuals must be identified and submit to a blood draw.
So there has to be someone who is skilled in collecting the sample and then processing that blood sample in ways that can be shipped to the laboratory where the analyses are actually done.
The Micronutrient Data Innovation Alliance, or DINA, comprises leading global experts in micronutrient deficiency, dedicated to driving collective action. One key objective of DINA is to develop new and innovative data tools and methods to predict micronutrient deficiency and the appropriate intervention. They're exploring technologies like AI to build population models for micronutrient status, leveraging individual biomarker data with population data on food availability, dietary intake, access to fortifiable foods, and the prevalence of diseases.
All of those different databases that have that kind of information are currently housed independently. There is no easy way to use those data together in a single analytic platform.
In 2020, Nepal, already considered a modern nutrition success story, used the World Food Programme's Fill the Nutrient Gap tool to combine these multiple data sources with their 25 years of population micronutrient data. they were able to generate population models that led to specific data-driven recommendations across agricultural practices, post-harvest fortification, education, food safety, social protections, and more. We know that interventions work. They've been working for 100 years. We aren't waiting for a new breakthrough or cure. A 2017 report from the World Bank estimated that the cost to scale up all global nutrition interventions, not just micronutrients, was just $70 billion over 10 years. That may seem like a lot, but for context, the U.S. spends $240 billion annually on healthcare directly related to tobacco use.
At this point, the persistence of these devastating deficiencies is a political choice. And we need to elevate this to say it is unacceptable that these deficiencies continue.
The Micronutrient Forum and its partners strive to raise awareness of this solvable global problem.
We would like to increase the availability of data around the world on the prevalence of micronutrient deficiencies so that the data that are available are mined more fully and disseminated more widely.
The most important thing is to have the right data at the right moment to the right people that guide the right action.
The world needs more mighty nutrient superheroes, those individuals who will step up to the problem and enact real change.
Are our leaders going to allow the devastation of these deficiencies to continue, or are we going to step up and act at scale? And I know that we can solve this problem.
Learn how you can join the fight against hidden hunger and be a micronutrient superhero at micronutrientforum.org/mighty.